Talk about gestational diabetes. This is impaired blood glucose regulation due to hormonal changes during pregnancy, including the rise of blood sugar levels and even insulin resistance. As you know, glucose and insulin needs increase throughout pregnancy. But now the insulin has trouble getting sugar into the cell with insulin. And you also know unstable glucose levels during pregnancy can result in dangerous effects on both the mother and the baby. So starting with newborn complications and big NCLEX tips, once again, be sure to write down the bolded and highlighted ones here. First up is macrosomia, a large baby size, over 4,000 grams, basically 8 pounds and 13 ounces. But be sure to write down the key term 4,000 grams. Next is hypoglycemia, that low blood sugar, in the newborn. So monitor for jitteriness as well as a glucose between 40 to 60. And we always encourage breastfeeding after delivery. The next one is elevated hematocrit in the newborn. This is what's known as polycythemia. We have an increased production of RBCs, those red blood cells. Now this was a top missed question on our NCLEX review that many students got wrong, so please listen close. Poorly controlled diabetes negatively affects fetal oxygenation due to the increased metabolic activity requiring more oxygen consumption. And this results in increased production of RBCs, those red blood cells, and therefore it increases the hematocrit levels. Now preterm labor and PROM is also increased, where the water breaks prematurely, and we have an increased risk for infection. We also see RDS, respiratory distress syndrome, basically immature lungs, from impaired surfactant production. Also fetal death with miscarriage and stillbirth. Now out of this entire list, the first one, macrosomia, was the most tested. So Saunders' NCLEX review mentions a client at risk for developing gestational diabetes during pregnancy. The client's last baby weighed 10 pounds at birth. Whoa, talk about a big baby. That's way over 4,000 grams. Now the last two complications here is hypomagnesemia, basically low magnesium. And the last one we see in the mother, preeclampsia, basically hypertension, from all that thick sugary blood inside the blood vessels. So HESI had two questions here. Maternal and neonatal risk associated with gestational diabetes, maternal preeclampsia, and fetal macrosomia. And question 2, associated with maternal diabetes, decreased magnesium, hypoglycemia, that low blood sugar, and respiratory distress syndrome. Now, in terms of risk factors, these include advanced maternal age over 35 years old, as well as being overweight or over 25 BMI, and even multiple gestation, for example, twins, triplets, etc. Think more placenta, more problems. Basically, we see more hormones and more problems. So HESI had a question. Increased risk for developing gestational diabetes. The client is 37 years old, the client is having twins, and the client's pre-pregnant weight was 190 pounds, 86 kilograms. Now for diagnostics, screening occurs at 24 to 28 weeks gestation. The two-step testing begins with number 1, a 1-hour glucose challenge test, a GCT. It consists of drinking a very sugary liquid containing about 50 grams of sugar, and then testing the blood sugar in about an hour. So the big key point here is that there's no fasting required initially. Huge NCLEX tip. It can be performed any time of the day. Now, if that glucose is less than 140, then this is normal. Now, if it's over 140, then this requires a 3-hour test. And this is where fasting is implemented, with hourly blood glucose checks. And the key term here is fasting. So please be sure to write that down. As far as signs and symptoms, these include expected manifestations with regular diabetes. So for hypoglycemia, this low sugar, we're going to see cool, pale, headaches, tremors, and clammy. So just think cool and clammy give that client some sugary candy. The client needs to increase their sugar. And on the opposite side, for hyperglycemia, we have loads of sugar inside the blood. So just think, the body will try and get all the sugar out of the body and into the potty by increasing urine, increasing thirst to drink fluids and dilute that sugar, as well as increasing hunger because the cells are starving here as all the sugar is in the bloodstream and not in the cell. So the signs and symptoms of high blood sugar is polyuria, that increased urine. So think poly is a lot and urea is urine. So lots of urine. The next poly is polydipsia, increased thirst. So think polydipsia, kind of like going for a dip in the pool. Lots of fluid and lots of urine. So think polydipsia is like going for a dip in the pool. The client's going to want a lot of fluid. And the last poly here is polyphagia, increased eating. Just think of the P in polyphagia is P for plates, lots of eating. And we also see drowsiness and constipation. So Saunders mentions newborn of a mother with diabetes mellitus, which is the priority nursing consideration, low blood glucose levels. And Hesse, symptoms of hyperglycemia, select all that apply, thirst, drowsiness, and constipation. Now moving on to treatments, we want to implement increased fetal monitoring like NST, those non-stress tests, to help monitor this at-risk pregnancy. And diet and exercise is always recommended first, before medications. So nutritional counseling for a diet that is high in fiber like fruits, veggies, and whole grains. These have the lowest glycemic index, meaning that sugar will hit the bloodstream very slowly. And always stay away from simple sugars like white bread, white rice, sugary juices, cakes, and even sweets. And we always teach mom to eat every 3 to 4 hours. Now, as far as medications, which are always used second, we can use oral meds as well as insulin, which we cover more in detail in the Pharmacology Mastery course. So Saunders NCLEX review had this question: gestational diabetes at 29 weeks. Which information should the nurse discuss with the client? Select all that apply. Okay, plan for weekly non-stress tests at 32 weeks. Obtain nutritional counseling. Yes, you guys can see how those two key terms come up quite often. And a Hesse question here. Client with gestational diabetes. What indicates an understanding? I will not go more than 4 hours throughout the day without eating. And lastly, Kaplan mentions gestational diabetes. Teaching is effective if the client selects which dessert. The big, huge cake, I'm just kidding, fresh fruit. Remember, fresh fruit and veggies are always the best options on the NCLEX and your exams. All right, that wraps it up. Thank you so